welcome everyone. Thank you to have Dr. Jason McGowan here with us today. And we saw this opportunity talking to our local team here in Denver to have you come over and spend some time with us today. Before we get into it, we had a chance to meet, but just kind of give us a background on you and tell NuVasive who you are.
Sure. So Jason McGowan, I was born and raised in St. Louis. Spent first 18 years of life there doing the things that people do in St. Louis, which is baseball, soccer, and then went down to Atlanta for undergrad, where I studied biology. Ultimately, that led to admission at Georgetown University School of Medicine. As I entered medical school, I thought hearts was the field for me, but I quickly received a lecture from one of the spine surgeons first day of medical school and immediately fell in love with spine. And that transition from an orthopedic love to a neurosurgical love, just by virtue of experience. And I maintained a position at Georgetown as a resident there in neurosurgery, and then advanced to the University of Pittsburgh with Dr. Okonkwo and Cantor for a complex spinal deformity fellowship. And now I'm out in Denver, Colorado, practicing at St. Anthony's Hospital, which is a level 1 trauma center, and enjoying life.
Well, thank you, and thank you again for joining us today. Well, listen, we'll jump in. We are on our second year of our journey to try to drive a more diverse and inclusive organization. Just want to get your thoughts on the importance of Black history and the recognition, what it means to you.
Growing up, it was more of a comfortable time for me, but I didn't see myself a lot amongst my friends, meaning that the demographic didn't necessarily look like me. And I think the first time I noticed the impact of that was when I went away to college and I transitioned from a school where it was 9% black to a school that was 99% black. And being surrounded by folks that look like you, that have the same sort of academic pursuits, same goals and same determination, you start to realize that the entire story might not always be told, or the entire story might not always be highlighted. So to represent the different corners of the world that may not, get all the press or may not get a lot of coverage, but to say, hey, you know what, we have a presence in neurosurgery, we have a presence in biomedical engineering, this is my story, this is how I got here, and then identify folks that you might be able to mentor and bring along so that you ensure that that same diversity, if not more, is present in the next generation.
You said, where you grew up versus where you went to college is Morehouse, right?
Correct.
What did you learn going to Morehouse versus where you grew up as more of a minority?
I think seeing yourself and sort of having representation where your professors look like you. Everybody that's surrounding you in terms of the different majors, no matter if it's business, political science, biochemistry, whatever the case may be, when you have a strong group, and for those not familiar, Morehouse is part of the Atlanta University Center, and there's actually 4 historically black colleges and universities there, so Morehouse, Spelman, Clark Atlanta, and then formerly Morris Brown. But when you're surrounded by 25,000 people that look like you and are all working towards a common goal, there's power to that, because, in other avenues and other places in the world, you don't have that same number of people that sort of share your phenotype. So more than what you learn there, it's knowing that there's an entire group of people working together and sort of seeing that camaraderie, especially in times now when camaraderie can be hard to come by, is important. Morehouse, the college, is about 3/4 of a mile from Morehouse School of Medicine. And at Morehouse School of Medicine, they had sort of a med school fair where lots of admissions offices were present and represented at this fair, and Georgetown University happened to send a representative to this meeting. And the person that I met I think it was a Sunday afternoon, the person I met there was the person who actually helped me get admitted to Georgetown University School of Medicine. So it's the opportunities where, schools and businesses and other entities sort of say, hey, you know what, we want to have a representative demographic, and Morehouse, being a part of the AUC, was one of those places where they were like, hey, you know what, there's a strong population of talent based here. Let's dedicate some resources to see if we can't find folks, and that's sort of how I made my way to Georgetown University School of Medicine.
Anything along that journey from Morehouse to Georgetown, anything stick out as, that Sentinel event that propelled you?
What I think really propelled me is that at that time, Morehouse tied with Harvard in terms of the number of black males that were admitted to medical school. So I was at sort of the premier, or one of the two premier institutions when it came to the numbers of students admitted into medical school and matriculating into medical school. So I found myself in a good position that supported my dream.
What challenge as a young African American pursuing a role in healthcare as a doctor? What challenges do you believe that you encountered because of race that you had to overcome along the way?
That's a good question. I think that in 2021, there's still an instant sort of perception of someone. And you may not know them, you may have never experienced or had an experience with that person before at all, but just sort of you see a glimpse of a person, you sort of have this perception. I think that part of the challenge is A, to not respond to it, and then B, not do the same thing, right? So the same opportunity exists for me when I walk into a patient's room in the ER to immediately snap to some judgment about this person. And I think the biggest challenge with that is that you can miss opportunities that might not otherwise be presented to you by making a snap decision. So I tried to flip that paradigm when I was a medical student, and in the sense that everybody recognizes me, you know, and if I walk onto a floor, I think there were 3 or maybe 4 black male residents at Georgetown at the time I was there. When I walk onto a floor, everybody knows who I am. So if you take that opportunity and you flip it, if you do good work, if you're nice to people, if you take good care of patients, you show dedication, now all of a sudden they're like, I know that guy, he's good. So it's taking that opportunity where you might feel alone and say, oh, I don't have anybody to identify with, but also flipping it on its head to turn it into your advantage.
When you feel that, I don't call it that perception of divisiveness or separation, we talked about this the other night. How do we bridge that? And we talked about the fact that everybody's talking at each other and sometimes not talking to each other, and it can be uncomfortable.
Right.
For you and I to talk about race, it can be uncomfortable. But how do we overcome that?
Yeah, it's accepting that, right? That it's not going to be a comfortable conversation, right? And the other thing that you have to accept is if we sat down here for 2 hours in earnest and we listened to each other, we're also not going to solve all the problems of the world. But what we can do is we can hear the world that we both live and interact in from someone else's perspective. And the power is to be able to listen to something, interpret it, and then say, you know what, I never thought of it this way, I will act differently, or, you know, this is something that I've never considered, right? And being open-minded doesn't mean that you're acknowledging that you were wrong or in some way that you should be defensive about something that's existed long before you were born. But it also is the first step to say, hey, you know, right now we're at a point where if we continue in this way, nothing positive will come from this. Part of the conversation and the majority of the conversation is listening. So if we ask, if we talk about the same scenario and you explain your perspective, I explain mine, if we don't say the same things, that's not a problem. That's actually the progress. It's to say, you know what, I never looked at it from this side. And, you know, talking about sort of hot topics, that's a big deal because my father, like I said, was in law enforcement. So, you know, I understand from the loved ones of law enforcement officials that this is a job where you put your life on the line every day.
Right.
Every time you walk out the house, you don't know if you're coming home, and you're doing a job where you're hoping to help people, but by doing that job, you're putting yourself at risk. So I understand that side of the coin because I've lived it. But I also know that, you know, there are things that can be done to make that interaction less violent, less intense, and you know, it's part of that is listening.
Let's kind of shift gears to healthcare, and you know, clearly you can't turn on the TV right now without experiencing and hearing the disparity in healthcare. COVID as an example, you're seeing the COVID situation impact you know, ethnic minorities in certain situations much more devastatingly than maybe it's broadly. You've seen healthcare in a lot of different areas. What's your perspective on the disparity in healthcare? Why is it? And then we'll get into a little bit, maybe what can we do about it?
The big word that comes to mind is trust. And historically, there have been examples where there's been distrust that's been sewn into the fabric of folks that look like me. Historically, that's the Tuskegee experiment, going all the way back to, the syphilis, treatment of syphilis and all the details associated with that. And I think there's two things that can come from this. Number one, and I've had a conversation with my mom and people in her age range, which is, we just don't go to doctors because there's no trust historically. And the question I always pose to them is, who does that hurt? Does that hurt the doctor? That hurts you, right? So what we need to do is we really need to figure out a way to increase representation. And I think that's part of the solution to disparity, is to say, hey, maybe you don't trust someone who doesn't have a similar background to you, and that's fine. I'm not saying that's right. I'm not saying that's wrong. But if you have more options of people that look similar to yourself, then you can take care of yourself and hopefully avoid some of the things that make us more susceptible to these things. So you look at the comorbidities associated with COVID, right? Obesity, diabetes, all the things that's sort of those check boxes. That's a high representation in our population, and I think in part that's because there is that systematic distrust of medicine.
How do we start to clearly changing the diversity of healthcare? I think whether we're talking about a med tech company or we said the other night, I don't see a lot of African American neurosurgeons. I see a few, but I don't see a lot. But in the short term, how can we help reestablish or start to build trust in these communities?
Yeah, so it's a theme almost where representation, I think, is key. And from a NuVasive standpoint, the goal is excellence, right? And that can never change, because that's what you are. That's why people like me associate ourselves with NuVasive, because we trust the product. We know that what you're doing from an innovative standpoint, an engineering standpoint, a delivery standpoint is top notch. So anything that takes away from that is a step that we can't afford to take. But the challenge is, if NuVasive says, hey, we find a lot of great recruits in robotics, engineering, marketing, sales, whatever it is from these 5 places, well, that's not to say those are the only 5 places that have excellent candidates. So the moving the needle is to say we're going to recruit from an area that historically might be overlooked, but we're going to maintain that same standard. And I think that exists. And partnerships like this, where you have someone who can reach back directly to Morehouse and say, hey, in your biomedical engineering, who are the top 5 candidates that you have right now? And then you say, I work with a company that helps with implants. We're doing big work to help patients feel better, make lives better, help people live healthier. We need people on this side of the house as well to help move the projects along. And I think when you partner with someone who has a direct line of communication with the Morehouses, the Howards, the Xaviers, the FAMUs, these other HBCUs, that's how we can ensure that we both maintain the standard by which all things are measured here, but also increase the diversity in the workforce.
Kind of putting those two concepts together, I think it's kind of an important thing for us as a company, maybe a society even to understand. We always talk about diversity and inclusion, but diversity could actually increase the effectiveness of healthcare based on putting those two things together.
I agree.
At NuVasive, we've continued to pursue diversity and inclusion, but looking at us from your eyes, what would you want to see companies like us do? What would you expect for us to, in support of the things we've just been talking about, what would set us apart, and what have you seen from other companies that we could incorporate? What does good look like here?
So I think it can be twofold, especially in healthcare. This is a very unique sort of opportunity where not only can you change on the corporate side, but you can also impact some of these disparities that we've been talking about before. I think as a spine surgeon, one of the hardest things to hear is the idea of a primary care physician protecting their patients from spine surgeons, or this notion that spine surgery is this bad thing where people go in and they come out worse. And looking at it from a corporate side, I think we just talked about how we can enrich the diversity here by starting to expand the areas that we find the talent. who can help with our projects and delivering the next and best things. But I think from a corporate side, when it comes to community outreach, partnering with physicians in different cities that you already have a relationship have demonstrated to you that they believe in clean indications, great outcomes, and say, you know what, we want to help patients. And that could be, youth leadership programs where NuVasive provides sawbones and the doc might give a talk and say, hey, you know what, this is what spinal fusion is, this is how you do a pedicle screw, and just that, that small investment to maybe reach one or two people that says, hey, you know what, this is interesting. Maybe from an industry side, maybe from a healthcare side. I think reaching out to neighborhoods and communities like church events where you can say, hey, you know what, NuVasive is going to sponsor something similar where you're like, we're going to bring in some sawbone models. We're going to show you, these are the options. Historically, we used to do it this way at NuVasive. We partner with physicians, insert name, to say, hey, we're doing circumferential minimally invasive neurosurgery. This means less opioids. This means quicker return to work. This means, decrease in pain. All the things people want to hear, but they may not get that, right? Because that's not the level of detail you get with your PCP when you go in to talk about back pain. So I think there's plenty of opportunity as NuVasive really continues to charter this course in terms of inclusion and diversity to say, hey, let's reach out to the community as a whole to establish trust, which is another one of those themes we're talking about, and let's reach out to some of these higher learning institutions that have some hidden talent and sort of find those people and incorporate them and bring them into the fold.
I like that a lot. I like the fact that, those that are out watching this, this interaction sometime in our future, it's important for people to understand that these diversity initiatives don't have to be a corporate-led initiative. It can be local. Matter of fact, I think in so many cases, it's much more impactful at a local level. It's hard to do at a corporate level. So I would encourage our organization to take it upon yourself to get out and learn how you can have local programs, because I think those things collectively actually change the game for us.
Right.
Let's talk about, we've come through a tough year, as a country, obviously as a society here in the U.S., a lot of different areas, COVID, but race relations. I mean, it's just been a divisive year. How did you see it? How did you experience it? And what did you learn from it?
Yeah, I learned this year that two entrenched camps without any mechanism for honest dialogue is going to persist as two entrenched camps. And I think that the onus is on those of us who find ourselves somewhere in the middle to reach out to those of us that find, well, not us, but those that find themselves on the lateral edges, And I think that one of the big things that we have to talk about is that we're all Americans, and although we're all Americans, we're going to have a very vastly different experience in this world. But to acknowledge that is not to say anything wrong of the person who says, you know what, I understand the way that you have to experience this world and the things that you have to worry about are different from the things that I have to worry about. And the steps forward include making differences in ways that we've talked about before. That may be speaking to your family, or that may be speaking to close friends to say, you know what, we're having this conversation in a safer place because we know each other, but I disagree with you, and I disagree with you for these reasons. And that can be where the impact is, because I think, bringing both extremes to the table, we've seen this time and time again, they walk away further entrenched in their position than when they entered the room. But the small steps in my mind are the steps that are going to be meaningful, is to say, when you're raising your kids, or when you have friends of your kids over at the house and you hear something, to say, hey, you know what, that's not here, we're not tolerating that.
So many times I think people are so committed to having their voice heard that they fail to actually listen to what the other side might be saying. Fostering those dialogues, I think, is important. It's one of the things that we're talking about at NuVasive is we use the word leveraging differences. And I say that because it's aspirational. Right. I think before we leverage differences, we have to actually appreciate differences. And to appreciate them, we have to actually talk about them.
Right.
What advice would you give somebody that wants to have a conversation but may be scared of, man, if I say something wrong, I'm going to be viewed as this, I'm going to be labeled as this, I'm going to be considered this. What advice would you give them?
I think if conversations come from an honest place, then all of that goes away. And that may be aspirational, that may be conceived by some as, not a reality. But where cancel culture comes in is when people say something, right? But if you're asking questions to say, help me understand how this impacts you, help me understand what it's like to tell your children that if you look a certain way, you have to act this way just to hope to get home. That question is not going to get you in trouble, right? We know that's real. If you're asking a question and you're trying to understand and you're trying to move the conversation in a productive way, I don't know too many reasonable-minded people that are going to be offended by that. In order for me to tell you about my experience, I have to acknowledge that you're going to ask questions to help to understand where I'm coming from. And just as it may be uncomfortable for you to ask questions, it may be uncomfortable for me to give you those answers. But if we're both coming to that place for a genuine purpose, then you have to lean into that uncomfortable feeling.
If you can't engage in a conversation, even if it's awkward,
Right.
then you can't ever find a starting point. At one of our national sales meetings, I was still at my former company, and there was a tremendously talented group of African American employees we had. I knew most of them really well. And in other settings, they were sort of the minority, they would kind of blend in, but in this situation, they were all kind of standing off by themselves. And I remember walking up and just asking, hey, can I ask a question? Well, why are you guys all standing? Why don't you intermingle with others? And the answer was something to the tune of, do you really want to know the answer to this?
Yeah.
Because we can't tell you now, but we'd like to talk about it. And that started a whole thing. It turned out to be, really good. But, if we wouldn't have started the conversation, we would have never gotten there.
Well, and it's interesting when you think about it from the standpoint that as a leader, you have tough conversations every day.
Yeah.
As a physician, I have tough conversations every day. And we have no problems doing that, or we wouldn't be where we are today. But the difficult part comes when there may not be a right or wrong, so to speak, or there may not be, this is the definitive course of action, this is the way we're going, right? You do that, I do that every day. If you couldn't do that, if I couldn't do that, we wouldn't be good at our jobs. But when you make it personal, and now there's a vulnerability because the confidence comes into all the work you've put in to get to this seat, all the work that I put in to get to this seat. But when you become vulnerable and you say, you know what, I don't know what the right answer is for this, and I don't know what it's like. I don't know what you've been through. There's an unfamiliarity which makes that very uncomfortable.
I think it's a great point. I'm very comfortable in my CEO hat. I can have pretty much conversations with anybody I want to and feel pretty confident, but when you got to shed that skin,
right,
and say, hey, I have any answer, and everybody's equal, and we all got to come together. It's a very different scenario. It scares me as much as it scares anybody.
Right.
Yeah. Well, listen, I can't thank you enough for coming out here, spending time with us, being with candor, with honesty, with transparency, which is honestly what we want to try to model for the organization. And so these types of conversations, I think, are great to get the conversation started. A lot more to do, and clearly, you said it earlier, we're not going to solve these problems in a day, but starting to bring common ground that we can sit down, not that we're opposing, but just the more we model, the more we start the conversation, the more that hopefully others will do the same.
Agreed. And thank you for the opportunity.
Thank you.